Hello, welcome to my micro lecture over The Bleeding Edge, a Netflix documentary about medical devices. New medical devices were more often promoted to increase profits, and people were drawn to new things because they think they're getting the best new innovations, even though they may not be proven effective or safe yet. It's relatively easy for new devices to be approved by the FDA compared to drugs. Loopholes can be used, and studies often have a small number of participants and are over a shorter duration of time. Companies can also conduct their own studies on the devices, so they share the results that they want to, and it is not objective. They do not have the patient's best interests in mind and will ignore risks if they can make a profit. Device companies are also very involved in lobbying to reduce the approval standards and avoid regulations. Adverse events occur as a result of these devices, and a low percentage of adverse events are actually reported when they do occur. I'll give a brief overview of the medical devices talked about in the documentary. The company Johnson & Johnson's marketing of the vaginal mesh implant was misleading about the safety and effectiveness and ignored the risks that it could cause for women. Surgeons knew how to put it in but not how to remove it, and it would scar in place and cause a lot of damage when they tried to remove it. The robot surgery machine had arms like this one and allowed surgeons to operate from a distance, but the training was much less than initially decided on, and they were much less experienced with it when they needed to be. In some cases, using the robot to perform surgeries increased risk, operation time, and was less effective, and this caused a lot of problems for people when their surgeries went wrong. There was a doctor that got a hip replacement with cobalt inside of it, and it caused more and more neurological issues, and he eventually found out it was due to the high levels of cobalt inside of him. He got it replaced and the ligaments surrounding the hip were disintegrated, but the issues went away. He noticed his patients having similar issues with the cobalt hip replacement and began a study doing brain scans on these people and finding abnormal results. The implant Assure caused things like extreme bleeding and pain, chronic inflammation, and people to need hysterectomies at a young age. It was hard to remove and fragmented inside of people. It caused risk for babies and failed pregnancies. One of the women started a Facebook group to discuss problems with the Assure device, and more people started to join and share their experiences. They eventually found the recording of the meeting for the approval of the device, and the testing was not unbiased. The person leading the trial's investigation owned stock in the company. Potential problems were not taken seriously and questions were left unanswered. Trial participants' answers were also influenced or changed. How does this connect to what we've learned in class? The documentary talks about how doctors would receive kickbacks not always in the form of money, but to promote devices or products even when they're not medically necessary. We also learned about healthcare marketing in our book, how things are marketed to gain the attention of consumers and convince them that they're necessary. We talked about ethical issues as allowing devices to be used without knowing if it's effective or safe yet, and not warning the patient about the risks, even though it may follow the laws. Is it ethical? So how does this documentary deepen our understanding of the course topics? It gives another look at how companies can cause harm with their marketing and misinformation, like we learned about with Purdue Pharma. The lack of regulations allows for these companies to be knowingly irresponsible because they're just trying to make a profit. It provides a deeper look into how medical devices can be marketed to people and how companies will try to cover up risks or negative effects. We talked about how hospitals are always trying to adjust and keep up with new technologies. Adequate training and knowledge about the devices they are using is often not really up to the standards that people would expect, and patients are unknowingly putting themselves at risk. Here's my reference to the documentary and a link to watch it. Thank you for watching my micro lecture.